Welcome. Welcome to our Denver Human Services Virtual Community Network meeting. And the focus today will be on housing and homelessness, and it's coming together to better serve Denver. Next slide, please, David. And again, there is our slide. Next slide. I wanted to let you know that if you have a question in our community network meeting today, you're welcome to go on the right-hand side of the screen and go into the Q&A and go ahead and type that question in for us. And we will get back to you with those questions in between each speaker. Also, you have the ability to go into live captions and in your video controls, and you are able to change or ask for captions as well as change the language if you need to. Next slide, please. So today's agenda, we have a lot going on. I am presenting today. Unfortunately, Christopher is not able to be with us. And then we're going to have Don Mayer speaking. He's our Executive Director of Human Services, as well as the Deputy Mayor. Then we have Patrice Hawkins, who is the Director of Community Impact and Strategic Planning. That's a huge job title. Followed by Bryn Daly, who will talk about our donations and drives. And then I'll talk a little bit about our Navigator 1.0 training. Today, though, we have speakers for the Housing and Homelessness series, and that would be James Ginsberg, who is our Deputy Director, or actually their Deputy Director for the Department of Housing Stability. It's called HOST. We also will have Meredith Ritchie, as well as Jacob Wesley from the Colorado Coalition for the Homeless that will be presenting as well. So we'll take a couple seconds. I'll let Don get settled in. And again, next slide, please, David. Again, we're welcoming our Deputy Mayor and our Denver Human Services Executive Director, Don Mayers. Hello, Don.
Well, good morning. Can you hear me all right?
Yes,
oh,
can hear you.
Excellent. Had to relocate to a new place, so I'm glad it's all working. Well, listen, I want to welcome everybody to this wonderful occasion, this wonderful meeting that we host every quarter. Just proud of the team that put this together, Kathy and Christopher and everybody. Appreciate all your work. And I just wanted to start by just talking a little about how excited we are about where we're headed with our new vision of our department that I've spoken about with you all a couple of times. As you remember, we created this vision that sort of answers the question, sort of, why does human services not get more involved in community and in making changes out there in community and working with partners in a way that may keep people from ever needing our services? That's just been sort of our mantra since the day I came in the door, really. So of late, we've been doing some great work. Anna Lisciani, who's been our strategic vision manager, has just been doing great work. But of late, I'm excited to announce that we have, I created a new Deputy Executive Director position. So that means I have 3 Deputy Executive Directors, one over the assistance programs, one over prevention, protection, and sort of facilities, and a third that I created, which is really going to be laser focused on community engagement in our strategic vision, Human Together. And very excited that we have promoted Patrice Hawkins to that position, who is just a rock star around her work, not only with community, but she's been in the city. She's worked in the Denver Peak Academy, so she's very steeped in how to ensure we have measurable outcomes. Just very excited. She's also a commish, so when you see her, you can also call her commish because she's on the Mayor's Youth Commission, which is pretty cool and has been for several years. So what we hope happens with this whole new group and with this effort is that it puts our work in community kind of on steroids, if you will, that after really doing a lot of thinking and talking about this issue, that we're going to start not just walking the talk, we're going to run the talk and really get out and talk to you all as partners about how we engage in a different way and in a deeper way, both on our essential service work, but also on our grander vision of helping community. So that's what we've been up to, and COVID has made it a little challenging to get all this stuff going, and it will certainly be an interesting dynamic about how we engage community. but I have little doubt that the department under Patrice's leadership for this effort will be just off the charts successful. So with that, I'd like to introduce our new Deputy Executive Director of Community Impact and Strategic Planning, Patrice Hawkins, who's going to share with some thoughts. So Patrice, the floor is yours. And again, congratulations on your wonderful promotion.
Well, thank you so much, Don, and good morning, everyone. I really appreciate that very warm introduction. So again, my name is Patrice Hawkins, and I'm thrilled to have the opportunity to speak with all of you this morning. I've been with the DHS family for a few years now, formerly serving as the Deputy Director of our Customer Experience for the Community Outreach and Resource Engagement team. So already been engaged a lot with community outreach and really honored to take on this new role. So in this new role as the Deputy Executive Director for our Community Impact and Strategic Planning, I'll help lead our marketing and communications team while also furthering the work of our strategic framework, Human Together, which Don just shared with you all. And most importantly, continue to build relationships and collaborations throughout the Denver community. So I hope to work with all of you closely to help build new relationships and partnerships and to just think innovatively about how we engage meaningfully in the community. So please do reach out if you have any additional questions about my position. I'd love to chat with you. While I can't get out and see everyone in person, I love to have those virtual AM coffees. So reach out anytime if you'd like to hear more about this position. So while we're on the topic of community impact, I also want to share with you a resource that we have here at Denver Human Services called our Emergency Assistance Program. So most of you know it in the past as General Assistance or GA, but we're calling it Emergency Assistance right now. With many people across our city experiencing the challenges associated with COVID-19, a changing economy, and economic instability, housing security has become an even greater stressor for many of our customers. Denver Human Services does operate an emergency assistance program to assist with the following resources. So I'm going to list these off, and if you have questions about them, please do use the Q&A, or we'll be sure to drop these in there so you can see them. First, we have eviction assistance. We also have first month's rent. We do deposit assistance. And we also have a mortgage assistance service that we can do. Many people don't know about this, so please do share this with your customers and the community that at Human Services we can also do mortgage assistance. We have utility assistance. We can pay for storage costs, so if someone is currently experiencing homelessness or maybe they're in transition and moving into a new place, we can assist with storage costs. We have a family reunification service available. And to share a little bit more about this, this is one of those programs where we will do some additional case management to make sure that someone is landing safely wherever they're going to. So many people who use family reunification have found maybe more sustainable or safer housing where friends, family, other relatives are. We will call and do some case management to make sure that when they arrive there, they have a safe situation. And finally, we can assist with emergency prescriptions. So this is another part of our program that many people don't know about. But for example, if someone has a life-threatening disease or illness that they're experiencing and a medication that they need, and maybe they're having a challenge paying for that prescription, we are able to assist with that. So emergency prescriptions also falls into our emergency assistance program. I do want to share that this is a bit different than the emergency disaster assistance that many are hearing about. For emergency disaster assistance, that is a program where you do have to have a child living in your home, but it often covers some different or multiple expenses, such as auto repairs. You could buy food with that assistance. You could pay a mental health bill, a regular health bill with that. You would apply for this on colorado.gov/peak by applying for Colorado Works or TANF. So it is slightly different than our emergency assistance program. So for all of the services I listed above around eviction or first month's rent, how you would access those. We have moved this service online. It can be found under the Applying for Assistance tab on the DHS website. And I believe we're going to try and pull that up for you so that you can see that on the screen. You are able to fill this out. It's an initial screening online. You can do it for a customer. So for those customers that do have access to a smartphone or internet within their home, they are able to fill that out on their own. But we recognize that many people right now are struggling with internet. And so as a community partner, you are able to fill that out for them. So it looks like we have it up on screen now for you. You can go to the Denver Human Services website. You would navigate down to Applying for Assistance, be able to click on that, and then after you click on Apply, you'll see Emergency Assistance if you scroll halfway down through this page. The Emergency Assistance is in the middle of the page there, and when you click on that, that's where you'll see our original or kind of initial screening tool. We've tried to simplify this to make it easier to fill out online, and again, so you could do this on a smartphone, and then we'll receive this on the back end. I'm super proud of our team who helped create this and set this up, because what it's done is it's allowed for a 24/7 operation. So many times we see applications coming in on Saturday or Sunday at 1 a.m. This can be filled out at any point in time, and our staff will be able to grab that and follow up with a customer. So we don't want things that are online to be a barrier for those without internet, and we do have a few additional ways that someone can submit an application. So one of those is actually by phone. They can call the Emergency Housing Assistance Hotline at 720-944-2032. This line is just for the programs I listed above. So again, it's that eviction assistance, first month's rent, storage, family reunification. That's what you would use this number for. I would encourage not to use this number for things like questions around food assistance or maybe your Medicaid application, because this one is dedicated to emergency housing assistance. I'll say that number one more time. It's 720-944-2032. So those without a phone may use a community partner or landlord that is willing and able to assist with starting the application. We try to maintain strong working relationships with a lot of property owners and management companies, just so we can help advocate for customers who don't have access to all of the technology to fill out the applications. And then finally, the document runner program is an option as well for those who need a paper copy or assistance getting the application. So maybe there's difficulty filling out the paperwork, no access to internet, they're experiencing a disability and would like someone to assist them walking through it. The document runner program will really help navigate that process. And again, please reach out if you feel like your customers or you are experiencing any barriers to our emergency assistance program. We're happy to think through how we can innovate and make that more efficient for you all. So over the last 2 months, we have been seeing an increasing demand for rental assistance, and I'm sure our other presenters will talk about that as well. But we are working diligently to process applications. We just ask for your assistance in helping customers provide all of their documents, or again, let us know if you're running into any unique barriers. So with that, I believe we have a few minutes, some additional time for questions, if there are any that I can help answer that might have been shared in the Q&A section. So,
and Patrice, I do not see any questions coming in right now for the general assistance, emergency assistance.
Wonderful. Thank you, Kathy. I'll be sticking around, and if any pop up, I'm happy to answer those. Thank you.
Actually, Patrice, just one did come up, and this is the question. It says, can you please clarify what services are being offered at the Castro building if someone just shows up there?
So for general assistance, which I was speaking of today, it's not in person, but they can access the paper application, or if they needed help filling out that initial screening tool we showed you online, there are staff on our front porch who could either provide that application or help them fill it out online if they prefer to do that on a smartphone or a tablet there. I'm speaking specifically for our emergency assistance program, but again, it is a virtual service and offering. I will say that the community outreach and resource engagement team has started to re-engage with several community partners. So for example, we do have an outreach worker who is located at eviction court that is in person on select days because the courts have opened back up. And so there are community partner sites where people can access some of our staff to assist. Some of it is virtual. So at Denver Rescue Mission, there is an outreach worker who's offering some of the services I listed above, but it is virtual, and Denver Rescue Mission is helping us connect with those customers in that way. Same with St. Francis Center. I know we can take applications there, so it doesn't have to be at 1200 Federal. Thanks, Kathy.
Okay, thank you, Patrice. Appreciate that. Next slide, David, please. All right, the next speaker we have is Bryn Daly. She is our donation and drives coordinator. Welcome, Bryn.
Thank you, Kathy. Hello, everybody. Happy Friday. I wanted to talk to you guys about our holiday gift drive, which is underway this month. If we can go to the next slide, please. So this is our annual holiday gift drive to collect holiday gifts for our families and children and older adults we serve at DHS who often have a harder time around the holidays. It can be more stressful financially if their family situations are more isolated. They can have a harder time, so we try to connect them with community members to give them holiday joy and make them feel that they can feel more connected and happy and have moments of celebration during this time, as we all should. So there are 3 ways that you can help our clients this year. You can register to sponsor a specific family, child, or older adult. There's a link on the actual slide. All of our information is on our website as well, which I'll mention at the end. All of this information is there, but you can register to adopt a specific family, child, or older adult. You'll receive their wish list and you'll be able to go shopping just for them. Very, very exciting way to connect with our community members that way. You can also donate general holiday gifts. This is we have online wish lists available for you to look through, and you can donate any of the items on that wish list. They'll be delivered directly to us so that we can get them distributed to our customers and clients in time for the holidays. We also have a general wish list with a general list of items that we look for different age groups for the holidays. If you would like to use a different service rather than You Give Goods or Amazon, you can use any service and send it to the address here so that we have it in time for the holidays and for our clients. And then the last way you can help is on the next slide. You can make a monetary donation, and then we'll be able to go shopping for even more holiday gifts for our clients. We unfortunately do not have a working online donation portal for the time being. So if you are interested in supporting this drive with a monetary donation, please consider a check sent to the address here with DHS Manager of Finance, made out, to DHS Manager of Finance, and with hashtag Be a Giver Holiday Gift Drive in the memo line. And that way we'll be able to use those funds to buy as many holiday gifts as we can for our clients who are vulnerable this time of year and are really in need, especially this year. Thank you so much for your interest and support. This is my contact information if anybody has any questions. We appreciate you and working with you, and thank you so much again.
Thank you, Bryn. Appreciate that. And does amazing work with the donations and drives. Next slide, please, David. That would be me. And I am the agency trainer, as I mentioned, with the core division, that's community outreach and resource engagement. And I've been with the trainer for the agency for close to 14 years. Next slide, please. We have our schedule for 2021. We only have a couple dates left in November and December for folks to sign up on Eventbrite. I can tell you since July, we have trained 558 individuals and over 102 organizations virtually. So we've had to go, online because of COVID. If you go to the next slide, please. You will see the dates for 2021. We should have a link up soon for folks to be able to register. And again, it's just basic eligibility and helping you navigate the system and teaching you where to find the information and just how we do processes. Also, to let you know, you'll be on my distribution list when you attend, and you're going to get updates about events that are happening. Example, we'll have the Denver Santa Claus shop. Save the date, it's out soon. We have information about other resource events. So again, if you would like to attend any of the Navigator trainings, please reach out to me. And again, you'll be able to register online. And we look forward to doing Navigator 2.0, which will be a deeper dive into all of our eligibility programs. So next slide, please, David. Okay, so we are looking at introducing James Ginsberg, who is from the Department of Housing Stability and the Commission on Housing and Homelessness. And I think it's about a year old, if I remember correctly. So go ahead and take it away, James.
It is. Thanks, Kathy, and good morning, everybody. And I'm really happy to be here, and I want to thank all of our partners out there who work tirelessly every day to address this critical issue of housing and homelessness. And as Kathy said, I'm the Deputy Director of Housing Stability and Homelessness Resolution. And the Department of Housing Stability, otherwise known as HOST, did just celebrate our 1-year anniversary in October, and it was established by the mayor by Executive Order 145. And this was really a way to elevate housing and homelessness and put various departments within the city of Denver under one roof. So we brought Denver's Road Home and various players and programs from Denver Department of Economic Development into the Department of Host. And it's organized in such a way where there's 3 divisions. So there's the Housing Stability and Homelessness Resolution Division, which I oversee, and then sort of on the other end of the continuum is the Housing Opportunity Division, which is overseen by Deborah Bustos. And that really is focused on the development side, working with the Housing Authority and private developers to ensure that we create much more needed affordable housing. I won't be talking about that side of the shop too much today. And then the third division is the operation, which sort of pulls all of that together. And the idea is to really elevate housing and homelessness to the position that it deserves in this critical time. And we have certainly seen this pandemic put a crisis on top of an emergency of affordable housing. And I want to talk today I want to focus a lot on the sheltering system and what we've been doing. And because, in an ideal world, we wouldn't have a sheltering system. We would have that rare event when someone fell into homelessness. It would be brief, and we would transition them quickly into affordable and safe and sometimes supportive housing. But we don't live in that world. And so we're trying to create a sheltering system that is trauma-informed and person-centered and strengths-based. And that's really our entree for persons experiencing homelessness into the treatment system, the supportive services system, and ultimately the housing system. And so I want to talk a little bit about what it was like, and this is pre-COVID, what happened, and what it's like now. Next slide. So what it was like, our existing sheltering capacity served approximately 2,134 guests pre-COVID, so up until about the middle of last March. And then this came along and it really blew up our sheltering system. It reduced the capacity to serve only 935 guests, next slide, and reduced the capacity by 1,199 beds, or 56%. And that was because we quickly needed to follow CDC and Department of Health guidelines for spacing and social distancing. We were trying to mitigate and avoid any catastrophic event of outbreaks within the sheltering system. And so we quickly needed to adjust and create a whole different operation. And as many of you know, in that response, in late March and early April, we opened up an auxiliary shelter at the National Western Complex that serves 750 guests, men. And soon after that, we opened up the Coliseum, the Denver Coliseum, to serve up to 300 women and transgender guests. We then had to adjust, as in mid-August, the National Western Complex retook back that space to start operating with their normal operation. And so we quickly moved the women and transgender guests into non-congregate or motel rooms at 2 different motel sites. We also worked with our current congregate and existing shelters to make sure that all of those beds were utilized appropriately. And then we moved the men, 300 of the men, over to the Coliseum, and to maximize that space. And then all at the same time, working with partners with Department of Human Services and the Colorado Coalition for the Homeless, and then the Salvation Army and many others, we, in addition to those auxiliary shelters, we opened up 810 motel rooms. And this was in the early spring with the peak, and at the peak in mid to late April of the COVID spike, we had about 265 motel rooms that were used for what's known as activated respite. So those were for guests that were unhoused that had COVID or were symptomatic and awaiting test results. And we had about the other 2/3 of the rooms for what's called protective action. And so those rooms are housing individuals who are more vulnerable to infection and negative consequences of infection, including hospitalization and higher mortality rate. And those are folks who are 65 and older and or have underlying chronic health conditions. As that spike started to reduce and we started to so-called bend the curve, we were able to transition a number of those rooms over to protective action and receive more guests, so up to 703 guests out of the congregate sheltering system, off the street and into these protective action rooms. And we currently operate 107 activated respite rooms. And recently we've been hovering about 45 or 50 occupied in the activated respite rooms, and we've been at pretty full capacity in the protective action rooms. And then with that, we've also added one additional emergency overflow shelter. We have responded and tried to stay nimble within city-owned facilities such as rec centers. And we recently opened the Alati Center for emergencies for overflow for women and transgender guests. And we've since operationalize that to be continuous for 24/7, at least through the winter. And so all of this was actually an incredible success in terms of reducing the spread of COVID. We were able to socially distance all of those 21 or 2,200 guests. We actually have a lower rate of infection within the homeless population than we do in the general population. And so all the efforts that all of our service providers, shelter providers, homeless service providers, outreach workers, and the city took to establish this entire sheltering network and response to the crisis has certainly paid off. And what this has done too is the sort of silver lining within this crisis response is it's really accelerated our 3-year shelter strategy, which was to convert the sheltering system away from just an overnight emergency response system where folks had to line up and queue up at night and then would have to leave in the morning. And it was always challenging to really provide adequate services, and people weren't sure if they would have a bed, into a 24/7 sheltering model, which has really transform the sheltering system in a very short period of time. And again, this is really credit to all our shelter providers who responded so quickly, who adjusted their model, who converted into 24/7 sheltering. And we want to continue to support that because ultimately the shelter is not an end to itself. Sheltering really needs to be a rehousing platform. And so we really want to continue to support that, to emphasize rehousing within the shelters. We want them to be, to understand that, sheltering, as good as we try to make it, is a traumatizing experience, and it can be. And certainly, as we all know, many people don't feel comfortable within shelter environments, and ultimately the solution to homelessness is homes. And so we're always moving in that direction. We want to continue to create appropriate spacing for fall and winter sheltering. We still are concerned about density. The other positive aspect of the crisis response and the 24/7 sheltering model is that it's really brought a lot more people indoors. And that's a wonderful thing, and we have to continue to expand our capacity. So we purchased another large facility out on 48th in Colorado, and we continue to rehab that, and we hope to open that late in the year and early in the first quarter. And we'll continue to partnership with agencies across the city. Many of you on this call, even if you don't have direct contact with persons experiencing homelessness, it touches most of our lives. And that includes city agency, Parks and Rec, Public Health, Denver Police, Fire, Mayor's Office, Human Services. And so all of our partners across the city, we're continuing to coordinate to have a strategic response. Next slide. Just want to give a quick snapshot. We took a survey in mid-June of the National Western Complex. We just wanted to get an understanding of where folks were coming from, because we were getting a lot of anecdotal information that a lot of folks had never been in the sheltering system. As the shelter providers enrolled them in HMIS, they saw that they had never been in the system. And so we wanted to understand where folks were coming from. And we saw that, of course, when you don't have an address, county boundary lines don't really mean anything, and that we found that a lot of folks, up to actually only 56% on this day of these 323 guests had been in Denver prior to coming to the National Western. And you can see many guests came from a variety of other counties around the metro region and Metro Denver, Adams and Arapahoe and Aurora. And so what we learned from this, next slide, we sort of knew, but it gave us some more objective data. Go ahead and go to the next slide, is that the 24/7 model, again, is bringing a lot more people indoors. And we need to increase capacity. But finally, what we've known, but we're starting to move forward with in a more coordinated effort, is this needs to be a regional partnership. A lot of our partners in these suburbs don't want people to be within their communities, people experiencing homelessness. They want to serve them in their community in vivo. That's really the best model. We don't want Denver to be attracting persons who are unhoused into the central area. We want this to be a regional response, and so we want to support partnerships, and we continue to move forward in that process. Next slide. So the sheltering as a rehousing platform, this is really where we're moving. We're already seeing a lot of fruit of this, that ideally we want the sheltering system to be less traumatizing, to be person-centered. And when folks are able to stay 24/7, shelter providers are able to develop greater relationships, are able to meet the needs much more quickly. I was with a gentleman just yesterday who was sleeping outside, had been homeless for 10 years. As I was chatting with him, quickly found out he was a veteran. He had PTSD, COPD, bipolar. And the more we talked, the more it was clear that he had been connected with the system. He was connected with the VA. He had been engaged by street outreach, but he recently missed the bus to his appointment to the VA to get his medication because he didn't have a mask, and so wasn't allowed on the bus. He had disconnected with street outreach because of a missed appointment, and this really, we see this script playing out time and time again. And so we were able to coordinate with our partners, with the Coalition for the Homeless, with Jefferson County, and get this gentleman into one of the protective action rooms. And so once he gets settled into this, and including in the shelter, now we'll be able to link him to these services much more quickly, get him an ID, get him reconnected with the VA. And so part of the homeless response system, understanding that sheltering is not an end of itself, but a critical component of the rehousing system. And so with that, both within protective action, especially, and in activated respite, these have been funded primarily within FEMA funding, but as long as the federal emergency response order is in place, that is sustainable, but this is not going to be sustainable for the long term. And so while we have this opportunity with people sort of settled into motel rooms and 24/7 sheltering, we really want to take advantage and invest additional resources to get folks out of these temporary housing opportunities and into more stable and permanent housing, individual housing. And so we created the Denver Rehousing Collaborative in August through an open RFP process. And this is focused on getting at least 200 households housed as quickly as possible. We're going to focus on the protective action and the shelter and the unsheltered, but we want to make sure we start reducing the capacity within the protective action motel rooms as quickly as possible, because again, we don't know how long that will be sustainable. These are funded partially by federal coronavirus relief funds, which expire at the end of the year, and so we need to act quickly to get folks housed, and as well as local affordable housing dollars. The collaborative partnership for the Denver Rehousing Collaborative is led by the Colorado Coalition for the Homeless, and it's multiple agencies, including the Salvation Army, Volunteers of America, Urban Peak, the Dolores Project, the Gathering Place are part of the partnership, but it also, of course, will be engaging many other partners that are working with persons experiencing homelessness, and they're already actively working with folks to get them into longer-term permanent housing. Next slide. So eligibility is broad. You just have to be experiencing homelessness. We will enroll everyone in the one home coordinated entry system, although many of the folks that we're starting to work with are enrolled. Part of that has to do with this funding is not permanent supportive housing, so it is time limited rental assistance and supportive services. So it's up to 2 years. And again, we want to focus first, the priority is on the protective action motel rooms. So those that are the most vulnerable, again, over 65 and or chronic health conditions. The reason we're looking at folks that may be currently employed or have an employment history within that group is for folks that can benefit from shorter term rental assistance and then be able to manage their rental on their own as they move forward, ideally with employment. And then also those who we've targeted who are older, who qualify for Section 202 or other supportive senior housing. And so again, this funding would be intensive supportive services, rental assistance, and then a really transition into longer term stable housing. Those living with disabilities who qualify for Section 811 or other supportive housing, those who are on housing choice voucher wait lists and need help until they reach the top. As many of you know, between coordinated entry, other wait lists for supportive housing, those can be long-term wait lists. And so again, we want to get folks quickly into supportive housing with rental assistance, and then on the back end transition them into longer-term stable housing. And then after focusing on the protective action, we will also be targeting folks who are living in existing auxiliary congregate shelters. And, you know, in an effort to get folks housed as quickly as possible, oftentimes it's guests who the shelter providers and homeless service providers maybe have a relationship, have been working with. Folks have their IDs, they have their documentation in place, and so we can quickly get them out of the sheltering system. And then finally, also focusing on folks through the Street Outreach Collaborative and other outreach efforts, folks right off the street and into permanent housing, which is the ideal state, and avoid the sheltering system altogether. Next slide. So the supportive services with the Rehousing Collaborative will include individualized person-centered plans to help maintain their housing, peer navigation services, to really want to increase people's engagement in the community. Of course, when people are struggling with homelessness, substance misuse, mental health issues, there's this huge sense of isolation, and we really want to help people engage with their community much more effectively and really incorporate and integrate to the greater community. And of course, comprehensive case management, employment, vocational, primary and behavioral health care services, and housing intake and navigation services. Next slide. So with that, I want to talk a little bit about the stabilization side. So of course, we want to get people housed as quickly as possible, but we also need to work on making sure people don't fall into the homeless service system. And so Patrice, of course, talked a bit about DHS's ability to do some level of rental assistance, and we've invested a lot of resources into our temporary rental and utility, or TRUA, program. And next slide, we're working with community partners, which includes Brothers Redevelopment. And this program provides up to 6 months of rental assistance and up to 2 occurrences of utility assistance. It will pay the full amount due. And it does focus on residents at or below the 80% of area median income. Most of the folks that are being served fall lower than that 80%, but that's the top end. Brothers will plan to serve approximately 1,485 excuse me, unduplicated households through March of 2021. Our other partner is Northeast Denver Housing Center, and the same, they'll be providing the same up to 6 months with 2 occurrence of utility, full amount due 80%, and they will be serving approximately 2,000 unduplicated households through March of 2021. So folks can access both of those partnerships to apply for those services and go directly to those 2 partners. Next slide. Just to give you a sense of the scale within this program, sort of pre-COVID and post-COVID and post-economic hardships, is in 2020, 1,796 unduplicated households were served, and 987 with local funds and 809 with CRF funds. And as you can see, that's through September, and all of 2019, 996 unduplicated households were served. So you can see an incredible increase in need and ability to serve more households. You can see the average number of months of assistance in 2019 was 2 months, and this year so far it's been 3 months, and the average amount of rental assistance has increased year over year, $300 a month. Next slide. So moving forward, you know, Host and with Denver's Road Home coming over with all their contracts, we support a variety, many partnerships through our housing and homelessness portfolio, and we've been involved over the last year in a very community engaged strategic planning effort. We recently have published our 2021 strategic plan, action plan for the year, and we have recently put out what we call our Super NOFA, Notice of Funding opportunity, and we've gotten over 100 applications. We're wanting to align our resource portfolio to align with our strategic planning to ensure that all of our resources are going, moving towards this ideal of housing outcomes and stability within the vulnerable populations. That we did have an open procurement process, and we're targeting, of course, prevention, stabilization, and then everything from street outreach to sheltering to housing to supportive services. And then on the very back end of that continuum, again, is the housing opportunity or the housing development side. And those awards will be now announced in the coming weeks to our variety of partners. And then with that, great news, we have, as probably all of you know, the Homeless Resolution Tax Fund was recently passed 2B, and those dollars will be coming through the Department of Housing Stability. And we are in a great position to funnel those dollars through this NOFA process, and potentially an additional NOFA for this year, but we'll be able to get those resources directly into service providers and into persons experiencing homelessness as quickly as possible. Again, we'll be supporting our 24/7 sheltering. We'll continue to enhance that system to ensure that people can get into shelters and get out of shelters as quickly as possible. We ultimately want to increase access to permanent and stable and supportive housing. We want to increase our integrated supportive services, both within the sheltering system and within the housing system, to include what we know is the best practice of integrated primary and behavioral health care, as well as other supportive services, vocational, employment, peer navigation. And then we also want to support enhanced street outreach to ensure that folks can get not only from the street into shelters, but ideally from the street directly into permanent housing. And with that, I think we have time for some questions.
And James, I have quite a few questions in here. I would like for you to review while he is doing that. The first question I'm going to ask you is, what is the plan of transition of the individuals who are in the protective action sites after COVID has been managed?
Yeah, thanks. That's a great question. So that's why we're focusing our initial rehousing collaborative on protective action. So the first plan is to get them into permanent housing or longer term stable housing. We may see, 2B as a resource to be able to continue to maintain those protective action motel rooms. There may be opportunities to convert some of those 6 motel rooms into permanent housing. There is some modeling around that. We again have expanded the shelter. We're working on expanding the shelter capacity. So if we need to stand down those protective action motel rooms, we want to be able to reabsorb them into the sheltering system as well.
There's another question I see in here is, when you say 24/7, does that mean walk-ins at any time as long as beds are available as well?
Yeah, great question. So we're still working through the access. Right now, access to the shelters for men's shelters is through Denver Rescue Mission Lawrence Street up until 8 p.m. and the Coliseum. And then access for women transgender guests is through Catholic Charities, Samaritan House. They are able to access some walk-up sheltering, women and transgender guests after hours, after 8 o'clock through Catholic Charities, Sam House. Outreach workers are able to bring some women and transgender guests to the Elati shelter as sort of a walk-in after hours. But right now, access to men's shelter, again, is through Lawrence Street into the Coliseum and into Holly Street shelter through Denver Rescue Mission. And then there is still walk-up shelter at Crossroads Shelter that's run by the Salvation Army.
Okay. And again, if there's other questions in the chat, James, if you have a chance to look at some of those while I'm also looking. If we don't answer the questions directly here, we can always respond back in our document that'll be posted. And I do see, yeah, go ahead, James.
Yeah, just I appreciate the disappointed with statements struggling with homeless followed by mental illness and addiction. No mention of unemployment, of economic downturn, loss of job, of housing. Thank you for that. And certainly homelessness is an affordable housing crisis. It's an economic crisis. It's a exposure to trauma crisis. It's a you know, and the it's not necessarily, certainly there's people struggling with addiction and mental health that are housed, and ultimately, again, the solution to homelessness is homes. And so I think it is important to talk about the affordable housing piece of this, and that's really central to this homelessness crisis, and that's why a big part of HOST is developing affordable housing opportunities directly and working with partners. So thank you for that.
James, there's another question that came up. What's the best or most immediate way to get someone connected to emergency shelter services and integrative care through DHS?
Yeah, so the emergency shelter system doesn't go directly through DHS. Again, the best way is to have men go to Lawrence Street Shelter downtown at Park Avenue in Lawrence, and for women to go to Sam House, which of course is kitty corner from their Samaritan House, women transgender guests. So that's the best way to access the sheltering system.
I'm looking to see if there's any other questions. I do know on our DHS website, when you're going in there, it will direct you to and answer a lot of questions concerning sheltering as well. So no other questions, then we'll move on.
As well as the HOST website on the Denver City will show you a direction to sheltering.
You bet. We'll make sure we get those links included in the PowerPoint as far as how to get directly to the HOST website as well as Denver Human Services. So one more question. Looks like when the Denver Coliseum closes, what is the transition plan for people staying at the Coliseum?
Yeah, thanks for that. So of course, the Denver Coliseum is owned by the city, so we do have more control of that as opposed to the National Western, which was privately owned. And so we hope to maintain that certainly through the winter, but in the eventuality that that does close, we are opening another shelter that will serve up to 450 guests. We're still looking at what population that will serve and how we'll integrate that into the overall sheltering system in terms of creating capacity for the women and transgender guests that may be displaced out of the Coliseum. But again, also continuing to really focus on investment into rehousing. So continuing to try to decrease the population within the sheltering system ultimately, but hoping to mitigate the closure of the Coliseum through the expansion of that new shelter.
Okay, wonderful. And I don't see any other questions coming in through my chat. So thank you again, James, for all the work that you're doing. I know I was involved in the first month with some of the different hotels and saw the amazing work that you were doing also along with the coalition. So thank you. Okay, moving on to our next portion. We'd like to introduce to all of you Meredith Ritchie, as well as Jacob Wesley for the Coalition for the Homeless. Welcome.
Thank you. Good morning, everyone. So for those of you who don't know much about the coalition, we have been around since the 80s, and our focus is permanent housing, healthcare, supportive care services, and advocacy. So we really focus on the post-shelter life into the more permanent solutions. And I have Jacob here, who is going to start chatting about some of the things that we offer. Next slide, please.
Hey everybody, I'm just waiting for the next slide to come up. I have to tell bad dad jokes in the meantime. Oh, okay, good, you're all saved. All right, so for housing, and then maybe one more click, we'll bring up some of the stats on this page. There we go. So the Coalition for Homeless does a wide variety of things when it comes to housing. We have over 19 properties that provide a variety of different types of housing. We do low-income tax credit housing. We do permanent supportive housing. We have the social impact bond, which is a form of permanent supportive housing. So the social impact bond particularly works with people who are high utilizers of the criminal justice system, and that's just one type of permanent supportive housing that we do. We have residential services, which provides on-site case management for folks who are deemed to need permanent supportive housing. Again, these are folks who, due to mental health and substance use struggles, need just additional support, and so those folks are embedded in the properties and work hand in hand with property management and also behavioral health staff to provide wraparound services to those folks housed in our buildings. We have a housing assistance department which manages all the vouchers those folks are on. So folks in our properties and all across the Denver metro area. We do different community living, and then recuperative care, which just says coming soon, is a really exciting thing we're doing where we're going to create a 24-hour respite facility that'll actually be right next door to our Stout Street Health Center. And so that'll allow people who have acute medical conditions who are not able to stay in shelters and who are not yet in housing to have a place to stay. So that'll be soon to be 20 properties once that comes on board, and there will also be permanent supportive housing that'll be built on the floors above that facility as well.
So some of the things that are, oh, I'm echoing, I think you need to turn it out, Jacob. So some of the things that are interesting for innovations in our housing is Jacob mentioned the social impact bond, which was a public-private partnership with our partners at Denver Human Services to help make this happen. And then next click, please. And then one of the people in the chat mentioned Fusion Studios, which was a really unique project for us because it allowed us to take a hotel and convert it into permanent supportive housing. And what was neat about that is it takes us about 1/3 of the time and the cost to do that when we already have a building in place. So we can house people much faster and be able to get them in the space that they need to. We also have 2 projects. Jacob mentioned just one of them, the recuperative care project, which is slated to break ground early part of 2021. And then today is actually the grand opening of our Fitzsimmons property, which is serves veterans, 60 veterans. It's in Aurora, Peoria, and 17th Street on the property of the Veterans Administration housing facility, as well as just down the street from the medical facility. So that will house 60 veterans and their families. And it's going to have the opening just today. So that's very exciting. We'll get people slated in to move into that next week. So we typically build about 1 property a year that we begin, and then they kind of roll into each other. So it takes us about 3 years to build a property from the ground up to get all the nuts and bolts squared away that we need to, versus something like Fusion Studios, which takes us about 11 months, I believe it took us this time. So just to give you an idea of some of the types of properties, and as Jacob mentioned, we have 19, so they wildly vary from everything from people who are single adults to full families of 3 or 4 children, and they are all throughout the state of Colorado, but most of them are in the Denver metro region. Next slide, please. So our healthcare services are an interesting part of the things that we like to talk about. We believe that housing is healthcare, but healthcare is also a very important component to how we serve people. We serve 15,000 people throughout the state of Colorado at 5 of our satellite locations, including, you may or may not know, the Stout Street Health Center that's just downtown. that we see a ton of people who come there. And what is really important for us to emphasize in how we provide healthcare is that we do integrated healthcare all under one roof. And the intentionality around that is that it's very difficult for someone, obviously, to travel multiple locations in order to access the care that they need. And having all of those in one space makes it much easier. So that it covers everything: medical care, mental health, substance use treatment, psychiatry, dentistry, vision services, pharmaceutical care. So they can get the prescriptions that they need filled even in that same space. And then satellite locations, which include things like our HOP, which is a really cool mobile unit that travels around the city to different shelters and outside of other spaces to help people get access. So what's kind of been fascinating for us to talk about in this is that before COVID, telemedicine was a very, very difficult thing to get reimbursed for, and is something that we really needed in general before COVID anyway, because when you're talking about people experiencing homelessness who are far and wide, it's easier to sometimes talk to them than it is to get them to come to the place that you need in order to access that care. So in 2020, this was super exciting for a legislative session to allow for telemedicine reimbursement so that we can provide these services where we need to, how we need to, all of the time. And that's been really great for us to get to do. You'll see on the right-hand side, this is Nina. She's wearing a backpack that is a really cool part of our street medicine that allows her to go out into the community and take someone's blood pressure and read their temperature and all of these other sorts of things, do basic wound care. And that backpack holds all of the key elements to that and allows her to connect to a doctor who would be sitting in our Stout Street Health Center or another space if necessary. Next slide. Go ahead, Jacob.
So yeah, when it comes to our supportive services, the thing I'm most fond of that you're going to see come up here is our Native American Talking Circle. So this is a really unique program that we offer. It's the only cultural specific program that we offer at the Coalition for the Homeless. So across most Native American tribes, there's a really common practice called a talking circle. And so what that looks like is essentially people go around and they pass around an eagle feather, and it's a really powerful experience where you only get to speak once when you have the feather, and it's a really unique experience. I apologize, hold on one second here. I apologize, there's a lot of background noise here. I've been able to participate in it, and it's really unique to be able to only speak once and only be able to speak what's on your heart in a single moment. And so that's been a really powerful program that we've been able to offer, and we've had a tremendous response from it. And we also combine behavioral health and case management support with that program, because we have a lot of folks in the Native American community who only access our services because of the talking circle. And then so it's really great to be able to use that as an entry point and then be able to provide them with healthcare, housing, and all the other supportive services that we offer. Fort Lyon has been a really powerful program that we have to provide people with support who struggle with substance use. And so that's a program we have down in Los Animas, Colorado, and access to proper substance use treatment, as everyone knows, is extremely difficult to come by. It's not technically treatment. Technically, it's called a supportive residential community. There's some nuanced differences there. It's kind of funny to speak about this in front of James Ginsberg, who was the director of that program and really helped completely develop it. So I won't do it total justice, but it has been a really transformative program where people can stay there up to 2 years. And really what we found most powerful has been the community that people build when they're down there. So it's not just going down there and getting a chance to address their substance use concerns, but it's really going down there to form a new community and really kind of experience transformation in that way. And then we've worked really hard to be able to provide them with housing on the back end. So people who successfully complete that program often end up in different types of permanent supportive housing all throughout the through Colorado. And referrals don't just come from Denver or just from the Coalition from the Homeless. There's referrals from all over the state that end up there, and it's been a really amazing program. We've seen people leave that community and actually become part of the local Los Animas community, find housing and jobs there. And then veteran services, we work directly with the VA to provide transitional housing. And as Meredith mentioned, we just completed a new building in collaboration with the VA, where we'll be housing formerly homeless, or they'll soon to be formerly homeless veterans. So that's a really exciting program. We also have employment services and childcare. So we understand that a huge barrier for people isn't just the housing or other supportive pieces like that. It can just be a simple case of how can you get a job or do some of these other things when you have, your kids to take care of. And so we offer an amazing childcare program that's been an award-winning program that's done really fantastic things. That's located out in Lakewood, Colorado. And then our employment services department also partners with the VA to provide some employment services specifically for veterans, and then also employment services for any current or formerly homeless individuals who just need support building a resume, finding a job, obtaining those skills to get employed. And then, of course, we provide, which somehow didn't come up in an earlier slide, we provide really comprehensive case management to folks both who do and don't want to access healthcare. So we have them embedded in our healthcare facility, and we also have them embedded in other facilities, so that when somebody, whether it's an individual or family, walks in off the street, that we can identify what their needs are and help them apply for a variety of different types of housing, and really are the gateway into a lot of the services that you see here. We help try to assess what their needs are and get into those services as needed. The best way to do so, and again, I apologize it didn't come up, the best way to refer someone to us for those general case management services, which is really just a good entry point and everything else, is either through Stout Street Health Center, which people can come Monday through Friday through business hours. New patients are recommended to come in the morning, and there's case management embedded in the health center. And then also at our 2100 Broadway location, any day at 8 a.m. People can come in. It's a little bit restricted due to COVID. We're currently trying to see as many as we can, and then they'll get connected to case management, and then instantly they can also get connected to behavioral health and other services as needed. Can you go ahead and do next slide, please?
That's good, thank you. So my team specifically focuses around advocacy. So all of the services that we provide to the organization and that exist in Colorado, we like to participate and need to participate in those to help advocate for more resources, more access for people experiencing homelessness. That includes Measure 2B, which we played a significant role in. We are very excited to have that new resource coming on board with us, because that will allow us to do a lot of the things that we continue to see as issues where we need more housing, and that's 2B will help to fund that. We need more supportive services. 2B will help to fund that. So it's really what we believe at the Coalition is it's public will that helps us drive a lot of these bills that we need. And so this year we sent, or last year, I guess, legislative session, which was extremely short, obviously, due to COVID. So this number would typically be significantly higher. But 715 emails came from people who believe what we believe, that housing is part of healthcare, that we need more of it, that we need access to resources ongoing for permanent solutions. And so having community members who participate in that conversation is really key to getting 20 bills with the outcome that we need, including telemedicine, including renter's assistance. Those are all really important things and are part of the big picture. They're not always necessarily directly related to the services that we provide, but they do impact the people that we serve. And so it's really important that we are able to do these things and to have a team that's dedicated to focusing on that. Next slide, please. and I'll talk a little bit about this, and then Jacob, I'll let you jump in, since James, I know you covered quite a bit on this already. I just want to mention what I think has been really fascinating and really important to this is that we all came together in this city to help do something that felt very impossible. In the onset of COVID, we were looking at people who are experiencing homelessness, knowing that that number, the potential to increase 40 to 45% for people who were just on the cusp of losing their homes, who are losing their jobs. And so coming together with lots of different partners, including the city, to make what became activated respite and protective action happen is just a really big feat to me to see. And so I'm grateful for the partnership to help to do all of this. And I guess that's all I want to say. Jacob, go ahead.
Yeah, and so because I think we're ahead of time, I think we started quite early. I'm going to tell a quick story about the start of these. You've been hearing people talk all day, and I know sometimes if you're like me, that can get to be a little much. So hopefully a little change in pace here is good. So, right, there's 800 rooms now, but this all started way back in March. We had somebody walk into the health center with COVID-like symptoms, get tested. About an hour later, somebody else came in, COVID-like symptoms, get tested. An hour later, somebody else. So suddenly we had 3 people who were suspected to have COVID, and we were all kind of sitting there looking at each other going, what do we do now? We can't have these people go back to the shelter and then potentially infect hundreds of other people. So what do you do? And so the health center called me, and a staff of mine and I tried to figure something out. And next thing I know, I'm in a van driving these people, trying to find appropriate shelter or motel voucher or something. Little did I know that I was riding around with my mask upside down and inside out, because I'd never wore a surgical mask before. These people were in the back of the van coughing, pulling their mask down, right? This was in the beginning, before we know a lot more about masking like we do now. And we found this motel, the Western Motor Inn, that was willing to take them, understood the situation, worked with them to stay isolated, got them food. And now the Western Motor Inn is one of our permanent sites. It's part of these 800 hotel rooms, and it soon grew from that one motel to 5 others for 6 total. And, you know, it's really been quite the amazing collaborative process where, you know, we saw DHS come on board. You know, Kathy, who we've seen on here, was working the front desk late at night, helping at Western Motor Inn make this operation work. Lots of DHS workers jumped in to help make this operation work, so did the National Guard. And so it's been quite the process, and we've been really excited to be a part of it. Similarly, I think that's the way the safe outdoor space is going to go. Hopefully a little bit more organized than me driving around with a mask upside down and inside out. But this idea of creating a safe space for people who are saying the shelter space doesn't work for them, right? You see it every day. Every time you see these big camps, people are saying shelters don't work for them. And so the city is working hard to work with Colorado Village Collaborative and others, including ourselves, to identify safe spaces where people can go and camp in a sanctioned way. And so we're really looking at how we do that, how we partner that with street outreach and other services. So the same way we all came together to create the activated respite and protective action, we're hopeful we can do that as well with the safe outdoor space for sure.
Great. I do see a couple questions in chat, Meredith and Jacob, and also James. If you see any that you would like me to ask or answer, we do have time to do that. I can quickly go to one for Meredith. Are these apartments income-based? And I think you mentioned they are.
So depending on where someone is, we provide permanent supportive housing. So permanent supportive housing is 30% of your income, which could be $0. So if you earn $0, then you will pay $0 to be able to access permanent supportive housing. Of course, affordable housing itself is a different animal, and that is 30% of your income. Those, at all of our properties, we have a mix of both of those. So the intention is that we have a few apartments that are affordable housing, a majority of the apartments that are permanent supportive housing, and that is across the board at the 19 properties that we have. Some have more that are in the affordable housing bucket than the permanent supportive, and vice versa.
Okay, there's another question here concerning hospice, and I think it may pertain to James or even you, Meredith, and Jacob, concerning hospice. Do either one of you want to take that one?
Yeah,
I can. Oh, James, you want to hop in?
No, go ahead, Jacob.
Well, the answer, I mean, essentially is the short answer, at least in my opinion, I hope I'm wrong, is no, there aren't really emergency hospice services. So we see this all the time where we meet people who either truly are hospice clients or end-of-life clients, or who need nursing level type care. And, you know, sometimes we can get people to a hospital and then quickly get them to a nursing home or assisted living using the hospital social work system, but often not. Often it doesn't go that smoothly. There is no like priority access or priority referrals. There's very little inpatient hospice care. In Denver, one of our nurses that we actually work closely with the Coalition for Homeless used to be a hospice nurse, and it identifies it as a key gap in services. So it's a very difficult thing. We've seen it at some of our protective action motel sites where we have people who can't manage their ADLs, and there's, you know, just lots of issues, and there's no really great way to transition them on quickly to a higher care level of facility.
Okay. And let's see here. This question came up: when beds are not available at a certain shelter, what is the process for helping people? Do you refer them out to other shelters? And do you have overflow shelter?
Yeah, so we continuously monitor the capacity in the sheltering system. You know, I know, you know, people sort of get attached to certain shelters, and we're hoping that, and we're seeing this, that the transition to 24/7 sheltering has sort of, well, it's been an incredible effort in reducing people's anxiety and trauma and having to move around. And it's reduced their need to sort of travel from shelter to shelter. So for the most part, guests are settling into specific shelters, but I know sometimes there may be capacity within only one of the shelters in the system, either for men or for women or transgender guests, and so that's the only shelter they can access. But so far, we've had capacity overall within the system. So again, it's sort of centralized in terms of going through Lawrence Street for men and Sam House for women, and then if the capacity, or if and when we get really close to capacity, then we open up auxiliary shelters such as a rec center.
Great. Okay, this other question just came in. Where can we find this list of all the apartments that are available in the city?
Sure. So just to clarify that, so we use the One Home coordinated entry system. So I'll show you where you can find it. But the important thing to know about that is that people are obviously then put on a list based off of their vulnerability. And then when a unit becomes available at whichever property that is, that's when that person would be housed. Now, that might not mean that they stay housed at that location because it's not their perfect fit or whatever the concern might be. But that's how this system works. So we participate in that, as do the rest of other permanent supportive housing and service providers in the city. So, yep, and that's the right website to get to One Home to learn more about the process. But our website does have a list. The coloradocoalition.org has a list of all of the properties that we have, where they're located, how much they go for affordable rent, as well as how many units are in there, and some images of them. So that's coloradocoalition.org, and then it's / let me get it for you. Get help. So you'd go to get help and then to housing, and at the bottom you'd see properties, map, and listing. A lot of the way that our website is set up right now is for people who are looking to access services. It goes through housing, healthcare, and those supportive services. And every single page has an explanation of what makes you eligible to participate in those services, how you get signed up for them, and what is the easiest access point. So that is outlined in something that we hope to push out all of the time to our clients. And we do have quite a number of clients who use our website. So we are trying to make it more user-friendly, of course, to make sure that they can get the information they need if they're using a computer.
Okay, there's another question that came in. And again, if we don't answer your questions now, we will send it out in a Q&A document. When clients either go to Stout Street or 2100, where is it, location, how does case management work? Will they have one case manager checking in on them on a regular basis? Do they create a housing plan with them?
That's a great question. So housing is extremely complicated, in case you didn't pick up on that from what Meredith just said. There's so many different types of housing in the city, and housing that we specifically connect people to. So yeah, when people come into 2100 Broadway, which I always point out that's North Broadway, because if you just put it into a GPS or something like that, it goes to South Broadway, or 2130 Stout Street, which is Stout Street Health Center, and meet one of our case managers there. So it's a large volume of people coming in to see those folks, right? It's not a group of case managers that have like a caseload of 40 clients. They could have 80 to 120 clients they're working with at any given time, all of whom need a different level of case management. So essentially what it looks like is the client, we ask a variety of questions to kind of do like a sort of like a mini assessment of what their needs are. And depending on how that goes, we do a variety of different things. So if they seem like they need permanent supportive housing because they have a high level of need, then we'll complete the VI SPDAT and go through the one home process like Meredith outlined. If there's someone who is disabled, and on Social Security, but doesn't need permanent supportive housing, then we'll help them apply for different what are called like HUD 202s or 811s throughout the community, which is just like subsidized properties that don't have any support attached to them. And there's a lot of other types of housing that we connect people to. So I guess we do create a housing plan. It's not what you would think in terms of they come in, they get assigned to work with me, and then every week I'm calling them to follow up. It's very client driven. So the clients can come back to walk-ins as much as they want. They'll also be scheduled individual appointments. And we try to follow up with those clients who fall off our radar, but because we do manage such large caseloads, it is dependent on the client kind of following up either through a walk-in or through an appointment. We try to make it really low barrier, and if they miss an appointment or they struggle to make appointments, we try to find other creative ways to meet with them. Outside of COVID, we'll go to them. We try to go to St. Francis and other locations to complete applications and do housing appointments there. Within COVID, we're really restricted in our ability to do those things. So yeah, hopefully that answers that question.
Also, another one, for those who are at a shelter, are they able to leave and come back, for example, to access other services?
Yeah, and that's really part of the beauty too of the 24/7 sheltering model, is so folks can leave. We certainly encourage them to take care of business, although discourage people from any movement that's non-essential, just like all of us. But folks can be gone all day, take care of what they need to take care of, and then their bed is reserved as long as they come back that night.
Okay. What are the rules around substance use and intake or being high at the shelter?
Yeah, so folks are in shelters, I think really across the sheltering system, are allowed to be intoxicated or high in the shelter. It's really just the shelter management really just responds to behavior. So as long as it doesn't pose a threat to themselves or others, and then of course there's no substance use within the shelter itself.
Okay, and that looks like the last question for now. Can a client walk into Stout Street Clinic and get connected to protective respite if eligible? How does that work? Do they need to bring anything with them?
That is another great question that I think might actually be easier to send out the info for. So technically, screenings for protective action to see if you have a qualifying condition goes through telephone visits. They try to do that, one, due to medical provider capacity. So as you can imagine, with COVID, we're stretched pretty thin trying to provide care all over the city at these different motels, in addition to the Coliseum, as well as our health center. And so telephone visits was found to be one of the easier ways, both for the clients and for the staff, to be able to manage those intakes. So we can certainly work with Kathy to get something sent out that outlines how to get a client into protective action. It's currently virtually full, just so people know. I think we had one male bed yesterday that got filled by actually James himself on the street doing outreach. And we have about, I think, 10 or so female beds left. I'd have to check on that one.
Okay, great. So David Palmer, if you can go to the next slide, if we don't have any other questions, and again, others will follow up with. You can hear this recording. We'll be posting it to this website. I also send out to my distribution list. If you're not on my distribution list, you can reach out to me. My email is kathy.crusan-ford@denvergov.org. If we can go to the next slide, please. These are the dates we have planned for 2021, and we're going to be putting out a survey to get input back from all of you as far as topics you'd like to see covered for the future. So stay tuned. If you are interested in participating, you could also reach out to our Deputy Director, Lusana Munoz, part of the core division. Next slide. And I think we may be done. And again, you can follow us on Facebook or Twitter, Instagram, and YouTube. And thank you for all participating today. Again, this information will be on our website. And please, all of you, stay safe and well. And thank you, James. And thank you, Meredith. And thank you, Jacob. And also Bryn. And Courtney Meals and David Palmer, thank you for helping as well with this presentation. Appreciate all of you. And also, thank you to Don Mayers and Patrice Hawkins for presenting as well. So everybody stay safe and well, and don't forget to wear your masks. Have a happy Thanksgiving. Bye-bye.